Hi everyone, my name is Chelsea. I'm going to be the occupational therapist in this demonstration, and this is Dantier. He's going to be our client. Dantier is a 27-year-old male, post an acquired brain injury due to a motorcycle accident. The motorcycle accident caused a lesion to form on the right fusiform gyrus of his temporal lobe. This lesion resulted in a condition known as prosopagnosia. Looking at familiar faces and recognizing them is an automatic process for most people. But for individuals like Dantier, living with prosopagnosia, this seemingly automatic process is disrupted. This is a neurologically based condition in which the process of identifying a face is impaired. Impairment can occur in 3 different stages. The first stage is construction of facial perception. The second is storage of visual memories for the face. And the third is storing semantic information. Depending on where the impairment occurs in this process is going to determine the level of dysfunction. So firstly, Dantier was administered the Cambridge Face Memory Test. This assessment is for short-term face recognition. It's going to show 6 different faces, and it's going to be presented in 3 different stages. The first stage is we're going to ask Dantier to recognize just the same image. So you're going to show him a face and ask him to point to that face in another image. The second stage is going to be asking Dantier to identify a face that's shown in different angles. So you might show him a face that's straight on and then one turned to the side, and you want to see if he can still identify the face even though it's turned to a different angle. And the third stage for that assessment is going to be recognizing the same face with heavy visual noise. So this might be if the picture is a little blurred or just some kind of distraction going on in the image and you want him to still be able to recognize that face. For our interventions today, we did a remedial and a compensatory approach. For the remedial approach, we did something called face matching task. This task is kind of similar to the Cambridge Face Memory Test, in which I'm going to show Dantier a target face, and then I'm going to ask him to point to that face in another image. So we're going to show you an example of how this would be done. I would show him an image like so, in which the face does not have any identifying features such as hair, or hairline or anything like that. It's just going to be the face and nothing else. There we go. And then I'm going to ask him to identify that person in these 3 different situations here. The first one is at an angle. The second one is straight on. And the third one is with visual noise. So you can kind of see how the picture on the third one is a little blurred out. All right. So Dantier, can you look at this picture and memorize this face? I'm going to give you 15 seconds to observe this picture, okay? At this time, I'll give him the chance to look over the face, identify the features on the face, and then we're going to move on to the next phase of identification. All right? In the first row, can you please point to the man that was in the previous photo? In the second row, could you please identify the man that was in the first photo? In the third row, could you please identify the man that was in the first photo? All right. Now, since Dantier has prosopagnosia, it is likely that he will not be able to identify this man in each picture. Therefore, I would keep working with him on this task in order for him to be able to have that spatial recognition of the face. So what we will be working on is repetition and having him match those faces so he can learn the different spatial areas of the face and be more readily and easily able to recognize him. It is important to note that with the remedial approach, you may not see results because this condition can be difficult for that person to be able to get that skill back and be able to learn how to recognize faces again. This is not an approach that you would use on an individual with developmental prosopagnosia, meaning they were born with it. Likely, if they're born with it, they're going to have that disability for the rest of their life. But since Dantier had a brain injury and prosopagnosia is acquired, there is a chance that he'll be able to gain that skill back. However, if results are not seen, you can always use the compensatory strategies. So we're going to do 2 compensatory strategies for our intervention today. So the first one is going to be, the therapist is going to teach Dantier how to use other features and other characteristics in order to identify a person. For instance, this might be looking at the person's height, the type of clothing that they wear, the tone of their voice, the way that their hair is cut or styled, even the way that they walk or their mannerisms and their gait. And then just any facial features that are unique to that person. For instance, if this is, let's say, Dantier's girlfriend, okay? She has some very distinct features that we're going to use to try to help Dantier recognize her face. So for instance, you'll notice that she has a bit of a cleft chin, so it's a bit of an indent here. You'll also see that she has freckles and brown eyes and a rounded nose. So these might be, and straight red hair. These might be some features that I would teach Dantier in order to help him recognize her. For the intervention, I would show Dantier a picture. Dantier, do you recognize the person in this photograph?
No.
Okay, that's all right. Can you identify some distinguishing features or just things that stand out about this person?
She has a butt chin, brown eyes, red hair. That's all.
Sure. Anything else?
Freckles.
Freckles. Okay. Can you think of anyone in your life that you're close to that has red hair and freckles?
Yes.
Who?
My girlfriend.
Your girlfriend. Absolutely. So this is a way that we can kind of connect this picture to the actual person, right? So next time you see she walks into your room, you see red hair and you see freckles, you might be able to infer a little bit better that that is your girlfriend walking into the room. And then based off of the tone of her voice, that should be able to give you the ultimate clue that that is your girlfriend, right? Does that make sense? Perfect. So that's just one example of a compensatory strategy that I could teach to use in order to help Dantier recognize faces. If he weren't able to learn from the remedial approach, I could teach him to clue in on different features of the face or different characteristics of a person in order for him to be able to readily recognize them in his life. If Dantier were to have a little bit of trouble with this, or let's just say that he needed to recognize, say, a coworker that didn't have very distinguishing, very distinct features, there is another compensatory approach that I would like to teach him. So for this one, I could introduce him to facial recognition apps. One in which I'm familiar with that's pretty effective is called Seeing AI. This app was originally actually made for people with visual deficits such as blindness, but it can also be used for prosopagnosia, because what you can do with this app,
Chelsea near zero faces, one face, zero faces,
is you can click person, and I've already
one face, zero faces.
I've already put myself in here, so once I show my face, it should be able to recognize me.
One face near Chelsea near center, 3 feet away, zero faces.
Chelsea near center. So what Dantier could do is when he meets a new person, he could either take a picture or you can upload a picture and then assign a name. So for instance, I'm his therapist. What he could do is we could download the app together. I could show him how to do that. I would tell
Chelsea
him,
near center, 3 Chelsea
Dantier,
zero, one face near bottom.
go ahead and click this button on the side to take a picture. Perfect. So now what we're going to do is we're going to upload this into the system. So it's pretty easy to do this. You're just going to click this plus button up here. You're going to take 3 pictures in 3 different angles. So face on, to the side, and then one on the other side, just so that the computer can kind of get a 360 view of, well, not really 360, but a 3-point view of the face. You're going to input that person's name. She might have a hard time saying Dantier's name, but we'll put it in. And then every time he shows up on the camera, she should be able to recognize him.
One face near Dantier near center, 2 feet away.
Dantier near center. now using the Seeing AI app, Dante's AI now can identify 2 different faces. He can use this across different settings in his life in order to more efficiently identify people if he's having a hard time identifying those characteristics or those specific features about a person. Now we kind of have an idea of a typical intervention session for an individual with prosopagnosia. Just to review, a good evaluation when you come in to have the intervention session with the client is to, just ask him, can you identify that person? Or even, can you identify me when you first walk into the room? And just, that's a good way to kind of track progress as you go along on if they're able to implement some of these strategies. And then it's also important to note that when possible, try to involve familiar faces in the intervention session. So instead of maybe using a picture of the girlfriend, maybe next session we could actually involve her real time in the intervention session and have her physically present within the intervention. That way he can better identify the features instead of through a picture, but through real life. Thank you guys so much for watching.